Dr. Mallika Marshall joins us live now to break all of this down. So, doctor, what are your thoughts about the booster shots?
Well, like I've been saying for a long time, we sort of knew that this day would eventually come. We just didn't know exactly when. And now we have this data showing that the effectiveness of the mRNA vaccines against getting infected declines over time. We're seeing more breakthrough infections, as you know. And admittedly, the goal of the vaccines is not to necessarily prevent infection, but to prevent severe illness. And the vaccines appear to remain effective against severe disease, hospitalization, and death. That said, health officials worry that these protections could also diminish over time, so they're advising that people who received the Pfizer or Moderna vaccines get a third dose 8 months after their second dose.
So how will we get the booster?
So people who received their doses earliest really should go first. That's nursing home residents, older individuals who were vaccinated at the beginning, healthcare workers. For example, my colleagues and I got our second doses in early January, so we're coming up very quickly on that 8-month mark. So those people should go first, and then other people as that 8 months progresses.
And it's interesting, this whole announcement applies to the Pfizer and Moderna vaccines, as you mentioned, but what about people who received the J&J vaccine?
So right now, those of you who received the J&J vaccine are sort of in a holding pattern, which I know is frustrating. Johnson & Johnson is currently studying whether giving a second dose of their vaccine is both safe and effective. We should know more in the next few weeks. We also are hoping to get more clarity on whether it's okay to mix and match vaccines. And, you know, people who got the J&J vaccine didn't really start getting vaccinated until March or so, so they might have a little bit more time. We'll have more information for those of you with the J&J vaccine soon.
A lot to stand by for. Dr. Mallika, thanks so much.